We are back with Dr. Jason Lowenstein here at Atlantic Health, home of Atlantic Sports Health, where Dr. Lowenstein's focused on the spine here for the hospital and really addressing the areas of scoliosis and low back injury, specifically spondylolisthesis and spondylolysis. What's the difference between the two?
So the difference between the two is that in a spondylolisthesis, you wind up having slippage between two bones. In a spondylolysis, you have a crack right here, and the crack happens on both sides. And that's the initial injury, and that's what starts causing the pain. When that cracks on both sides and you start getting wear and tear of the disc and you start getting translation where one vertebra slips on the other, that's the listhesis, that's the spondylolisthesis.
Yeah, and this is common with kids. It's amazing how the research I've read, it's almost 1 in 10 might have something like this and might not even know it.
Yeah, it's super prevalent, and it's also something that may happen, heal, and happen again. So oftentimes, if kids are complaining of back pain or having these intermittent issues, it oftentimes is this. It's oftentimes this. The reason why the fracture happens in the bone in kids as opposed to a disc injury, which usually happens in adults, is that in kids, the bone is actually softer than the disc. So in kids are more common to get the fractures, the crack in the back, which can go on to heal. They have good healing potential, but it can happen over and over.
That's interesting. The bone is softer than the disc in kids, and that's why it happens more in young kids.
It's cartilage, it's developing bone, it isn't fully ossified, it's not mature bone like adults have.
Right. And with kids being active and they're playing a lot of sports and they're hyperextending, that's where these issues can come about. So it's nothing to be super alarmed about, but awareness is really important.
Absolutely.
And to keep good neutral spine and to manage those hyperextended motions. And also, we talked about core work. So important to strengthen that anterior core so you can manage that extension and hold it in place.
Absolutely.
Yeah. So one of the things we recommend highly are core stabilization exercises such as planks or modified ab crunches where we don't come all the way up because we want to avoid flexion or overflexion, but really create that stiffening in the core, because the key element to core health and spine health is understanding how to stiffen and brace. So teaching kids how to brace. What are some of the recommendations you give parents in terms of the recovery process of this diagnosis? Obviously, core stiffening. Do you typically recommend therapy? What is the diagnosis or prognosis?
In a patient who develops a spondylolysis or stress fracture that is in the acute injury phase, usually we brace them. Usually we put them in a brace to try to immobilize the spine to allow the fracture to heal.
Gotcha.
Once you get stickiness to the fracture, once it starts healing, oftentimes at that point we'll start the patient in physical therapy to try to do some strengthening exercises. But it's really, like you said, about balancing your spine. You want the muscles in the front to be balanced by the muscles in your back to try to help support and strengthen the entire structure around your spine, which is why planks and core strengthening is so important.
Sure. It makes perfect sense. You got the spinal column, that huge antenna that you might see on the highways, and you got those cords, those guy wires, if you will, that hold it in place. Those are all the core stabilizing muscles, with the antenna being the spine. Doc, thank you so much.
It's my pleasure.
Really informative.
Thank you.
And I know this is common out there, and people kind of hear these words, spondylolisthesis, spondylolysis, what is all this? But now it's made simple, so you can now take action to get your child, get yourself to the next level and have a healthy spine.